Hi, welcome. Thanks for coming in today. I know we're going to talk about your labs and hormone replacement potential plans, but you might have some questions regarding perimenopause, as I saw in your notes, and or menopause. So what can I answer today for you? Okay, so the word peri means around, so it's around menopause. And typically speaking, we do have some measures that will tell us if women are in menopause by a blood work and or if you've had no period for a year. But the sad part is that a lot of times patients will go to doctors that tell them, oh, you're not quite there yet. So this whole syndrome of perimenopause is very vague, and oftentimes people are left to just deal with some of the symptoms that they're experiencing, which we'll go over in a second. And so really there isn't a specific blood test that I can do for you. However, in my practice, I use the information that you're experiencing, symptoms and labs, and your physical kind of complaints that you may be having. And then we devise a plan for hormone optimization, which can include either dealing with testosterone, estrogen, progesterone, thyroid. So let's talk a little bit about the symptoms that you might be experiencing. What are you feeling? Yeah, those are some of the classics for sure. So I would say that a lot of times patients are experiencing very similar, as you can tell, that you might have heard some women are having these same experiences in menopause. So there isn't a syndrome of perimenopause that can seem vastly different than menopause. So brain fog, night sweats, poor sleep, loss of libido, loss of hair, difficulty losing weight in your midsection or putting on weight in areas you never have had before. Even anywhere from heart palpitations, nausea, non-specific aches and pains. So because it sounds so general, people think there's just nothing that's going to make me feel better. How can this even make sense that I might have something just with a few hormones that can throw this many systems off? But the good news is that there is a blood work test that we can look at today, and your labs will kind of indicate where you are, and then some more specific questions I'm going to ask about your periods and things that might have changed. So I don't know if that helps you with the questions or the symptoms that you may be experiencing with perimenopause. Has anybody ever looked at your blood work before? Has anybody mentioned to you that you're not quite in menopause and that these symptoms don't necessarily mean that it's a hormonal imbalance? Has anybody looked at your thyroid hormones before? So I think in my practice, I like to use a diagram to show just how important some of these hormones from our brain to our actual organs themselves will tell us just where we could be in terms of menopause and or our thyroid strength. So if you want to come a little closer, I would just show you on here. I always draw this picture of what I call like the master controller of our hormones. It's a gland in our brain called the pituitary gland. And it sends out these, we call them, like we short form them like stimulating hormones. So if I look at your follicle stimulating hormone, it sends a signal to your ovaries and your uterus, and it tells us where in our monthly cycle we may be. So it tells us how much estrogen and progesterone we could be making. So if I look at your follicle stimulating hormone and it's more than 25, and in your case it's not, but if it was more than 25 or you hadn't had a period in a year, I could say, I think that you're in menopause. Or by our kind of measure, you're in menopause, especially if you have low estrogen and low progesterone. So in your case, if we haven't quite achieved this number and you're still having a period every month, you could be in perimenopause. So I'm suggesting that we still consider some alternatives to figuring out what would take care of some of your sleep issues and different symptoms that you're experiencing. So then I also wanted to just mention that just because we look at this hormone and we don't necessarily see the testosterone being driven from this follicle stimulating hormone, I still want to take a good amount of time to talk about how I believe that testosterone is very important in the perimenopausal and menopause time. So have you heard about testosterone replacement before? Has anybody mentioned that to you? So testosterone in women is produced in the ovary, and it's also produced in our tissues, our fat tissues, and our adrenal gland. So there's actually 3 sources of testosterone, And we typically have a fairly steady amount of testosterone in our body at all times versus estrogen and progesterone that can go up and down throughout the month. So when we see blood work such as yours to suggest that your testosterone is very low, it may still be in the reference range of normal, which we can get to in a second, but it's low on that reference range of the lab reference range. I'm encouraging us to have a healthy discussion about what benefits you would see to replacing your testosterone. And that, for me, is kind of the magic of this program. Because if you don't need estrogen and progesterone at this time because you're in this perimenopausal phase, this is like an individual kind of thought process, of course, because everybody's labs will dictate differently, and that's what I love to talk to my patients about, the fact that not one size fits all. Your testosterone, I believe, is really what's driving a lot of your symptoms. Low testosterone can make you have the brain fog. It can have you have poor sleep, poor stamina, difficulty getting into a healthy exercise routine because of loss of stamina after exercise, the non-specific aches and pains, the inability to lose weight, and you can have skin and hair changes, definitely thinning hair related to testosterone deficiency. And the one thing that I would say that most people don't realize, and that I've seen, I wish I could have this documented as a research, but testosterone and mood. I really think it's important to note that in most of my patients, the number one thing I see from patients after they have their testosterone replaced and they return to see me a few weeks later is that their ability to handle stress is improved. That irritability phase that they often call like PMS, or just any specific kind of like grumpiness, irritability, difficulty handling stress, is really alleviated with the testosterone. And so patients will also say, it's not just irritability, my anxiety is better, my down in the dumps, kind of like not quite depression, but that low borderline depression feeling is improved with testosterone. So this is what I would discuss with you today based on what I see in your blood work is the plan to think about testosterone replacement in this phase that you're in perimenopause. And then we can discuss, what I would tell you is the way that we can replace the testosterone effectively, and in my experience, in my expertise, the best way to get testosterone into your system.